Hi everybody, it's Jeff Ward. My dissertation proposal is on the proactive use of cold water immersion to mitigate burnout symptoms in collegiate basketball players. So through the research, I found that burnout is on the rise in collegiate athletics. I've also seen that anecdotally at the institution that I'm at, and that's why I'm interested in pursuing this. The research shows that burnout is a consequence of chronic stress and oftentimes under recovery. So I'm looking at ways that sports medicine professionals can mitigate burnout. I can't necessarily control for the stress, right? The stress that comes from overtraining, coaching. I can obviously talk about workloads, but my focus is more on the recovery side. The cold therapy have shown to have some effects on mental health, including depression, anxiety, but also affect, mood, and those things could have an influence on coping strategies towards potential burnout. So the purpose of my research is to evaluate the effects of proactive cold water immersion as an intervention strategy to reduce the incidence of severity of burnout symptoms in collegiate basketball players. My specific aims are to identify fluctuations in burnout symptoms and perceived stress and recovery states as compared to baseline measurements throughout the semester. Assess the effectiveness of cold water immersion on perceived stress and recovery states as well as burnout. And then lastly, to identify strategies student athletes perceive to be effective in mitigating burnout symptoms. Participants will be our men and women's basketball teams at the college that I'm at. Both teams typically average 12 to 15 players per roster, so I anticipate 24 to 30 subjects in this study. It'll be a mixed method study. The quantitative data will come from two questionnaires, the ABQ, that measures athlete burnout, and then the RESQ, which measures perceived stress and recovery. We'll do a baseline test prior to the season starting, and then every 2 weeks they'll complete these questionnaires. Each questionnaire, the ABQ is 15 questions, and the RESQ is 32 questions. We're going to use the short version. I anticipate both questionnaires taking about 7 to 10 minutes. Obviously, it's going to involve ice baths. They're going to ice between 2 and 3 times a week, and then at the end of the year, we'll interview them and to see what they felt, what they perceived the benefits were. Great education tool for our coaches to get a pulse on both burnout as well as the perceived stress and recovery of their athletes. We'll be able to proactively set up recovery programs and then explore other interventions to see the benefits